answering your questions about your low back pain. So as you know, this month has been Low Back Pain Month at Physical Therapy for Everybody, and we have gotten some really great questions from people regarding their low back pain. So while I'm on here live, if you have any questions specifically regarding your low back pain, you can drop them in the chat and I will go ahead and answer them right now. But I'm going to start off answering the questions we have gotten over the past month regarding low back pain, and specifically regarding our clinic and how we treat low back pain. So a couple of ways that our clinic is different when it comes specifically to low back pain. The first thing is we want to get to the root cause of your low back pain. We want to figure out what is causing it. There's tons of different things in your low back. It could be your disc, it could be your vertebrae, it could be a ligament or a tendon or a muscle. All kinds of different things can cause low back pain. So we want to figure out what's causing your low back pain. And admittedly, it may be more than one. But we need to figure out what the root cause is so that we know how to treat it, right? Excuse me. So then we're going to come up with a treatment plan that's going to deal directly with your low back pain, not your neighbor's low back pain, not your brother's low back pain, not your parents' low back pain, your low back pain and what's actually causing it. Then we're going to come up with some really specific exercises that are specific to your low back pain. So we're not going to give you a sheet of exercises, the same sheet that we give to everybody. We're going to customize the exercises specifically for what you need because of the root cause of your low back pain. So that's how we do things differently here in regards to low back pain at Physical Therapy for Everybody. And another thing that people have really been wondering about is, and actually what it looks like and it feels like in here, particularly in regards to personal space. So I am actually sitting in one of our treatment rooms. In our clinic, we have two different treatment rooms. So when you are with your therapist receiving hands-on physical therapy, you will be in a treatment room. So you can come in, you can drop your jacket, you can drop your purse or your keys or whatever, and it's in a room and not in a common area, so you don't have to worry about it. You know that everything's really safe because it's right there with you. So I'm going to try to do this slowly so I don't make anybody sick. But this is what our treatment room looks like. I'm going to kind of come out here so you can see it. I'll try to bring this down so you can see. So that's the table. It's actually really cool. It's a high-low table, so we can adjust it up and down. It has a nice face cradle, so if you need to be laying face down, you don't have to turn your neck to the side because that's pretty uncomfortable. And that's where you'll be for the hands-on part of the treatment. Now I'm going to walk out here. Again, I'm going to try to do it slowly so I don't make anybody sick and show you guys our gym. So we have a small gym area, but that's okay because we only have one or two people in here at a time. And if you come out to this area to do your exercises, because sometimes we do exercises in the room, we've got a great table for it. But if you come out here to do your exercises, use the pulley, or use any of the equipment that we have, then you'll be with your therapist the whole time. So the person that you are here to see is the person you will see the entire time you're here. Most of our treatments last an hour long, so you will be with your therapist for an entire hour. As I mentioned earlier, you have your own room that you'll be in, and you can bring your stuff in and not have to worry about it being out in a common area. And you can leave it in there when you come out to the gym to do your exercises. While you do your exercises, you will have your therapist standing right there doing all the counting for you and probably try to distract you a little bit by talking to you while you're doing the exercises because, sometimes it can be, a little boring doing 20 of something. But even when we're here in the gym, we come up with really specific exercises that we do for patients. And actually right behind me are our pulleys, which is one of my favorite things to do because you can set up a really specific resistance for people and you can adjust them to get just the right angle for what that person needs. I'm not a big fan of TheraBands, honestly. I'm going to tell you guys, and you'll hear it if you come in here. I'm not a big fan because you don't have the same resistance all the way through the joint range of motion. So if you're trying to work on getting your shoulder up over your head and you're holding onto a TheraBand, you're not going to have that same level of resistance at the beginning as you do at the end. So that's why I like the pulleys, because then you're going to make sure you have the same resistance all the way through. So I hope that's helpful for you guys. That's a big question that we've had as we've had new patients coming in this month with our low back pain. And after they've heard us on Facebook and things, they've been really concerned about personal space and also wanting to understand, you know, if they'll be in a gym with a lot of other patients. I know a lot of PT clinics, you're in kind of an open area or the gym, and there's just a bunch of tables lined up, and it doesn't necessarily feel very personalized because sometimes it feels like the PTs are just talking to each other and not interacting with the clients. So that doesn't happen here. You will be in your own room with your own therapist. And then if you come out to the gym, then you again will be with your therapist, and there will be no more than 2 people in the gym at the time because we only have 2 rooms. So there can only be 2 clients in here at a time. So I hope that's helpful. I hope you guys have a great weekend. Feel free if you want to sign up or call us for a body chat. Our body chat is how we get to know you and hear your story, learn more about what's going on with you, to see if we are the best fit to get you where you want to be and to help you achieve your goals. So if you're interested in calling us for a body chat, our phone number is 425-658-4944. You can always drop a note here and we'll respond to it. Or you can find us on our website, www.physicaltherapyforeverybody.com. All right, have a great day, everyone. Bye.